since a good portion of you are in the age that the CDC recommends be tested for hepatitis, that's what I'm going to be talking to you about. So, understanding hepatitis. Hepatitis is inflammation of the liver, can be caused by toxins in the blood, certain drugs, diseases, heavy alcohol use over an extended period of time, and bacterial and viral infections. As you can see pictured on the side, there is a picture of a healthy liver and then a picture of a liver infected by hepatitis. So hepatitis C is a bloodborne virus that was previously referred to as non-A and non-B hepatitis until it was later named hepatitis C specifically. There are 7 major genotypes basically being the genetic makeup of the virus. So it, based on your genotype, it tells what region of the country you basically contracted the virus in. It's transmitted through direct blood-to-blood contact. So once it enters the body via infected blood, it attacks and multiplies in the liver, thus killing existing liver cells and leading to fibrosis and eventually turning into cirrhosis. Fibrosis causes the liver to scar. If left untreated and continuing to scar, that's when it turns into cirrhosis. Heavy scarring indicating cirrhosis can eventually lead to liver cancer and death. So how common is Hep C? According to the CDC, in 2009, there were an estimated 16,000 acute Hep C virus infections reported in the United States, and an estimated 3.2 million people in the U.S. have chronic hepatitis C infection. So acute being short term, you clear the virus yourself, usually within 6 months. Chronic being long term. And approximately 75 to 85% of the people who become infected with Hep C develop chronic infection. How is Hep C spread? Like I said, it's blood-to-blood contact, so things that people usually don't think to spread Hep C are toothbrushes, shaving razors, and needles, because blood of the infected person could get on the toothbrush if you share it with someone else. Usually your gums tend to bleed. You can get the infected blood mixed with your blood, and just by means of brushing your teeth, you automatically have Hep C. Blood transfusions and transplants prior to 1992, because prior to 1992, the CDC didn't require screening of blood before it was used in other people. Likewise, in 1987, if you were treated prior to 1987 for blood clotting disease, the blood wasn't screened then either. Sexual contact, though, it's not as prevalent as far as transmission, especially if you're in a long-term anonymous relationship. And then just down at the bottom it says that it's not spread by hugging, kissing, coughing, sneezing, holding hands, sharing eating utensils, or breastfeeding. So who's most at risk for Hep C? Past and current IV drug or injection drug users, regardless of how long it's been since you've used drugs. Blood organ recipients before 1992, since the CDC didn't require that they were screened. Patients that are on hemodialysis or have had dialysis over the course of many years because of kidney failure. People who receive body piercings and tattoos in a non-sterile environment. People co-infected with HIV. And then children born to mothers that were infected with hepatitis C at the time of their birth. And then where most of my audience comes into play, the CDC has suggested that anyone born between 1945 and 1965 be tested for Hep C as a one-time only precaution, just because it's during that baby boomer period that 75% of the Hep C population is people born within that time frame. So even just as a one-time kind of preventative measure, it's just good to be tested for Hep C if you were born within that time frame. So we talked a little bit earlier about fibrosis and cirrhosis. Fibrosis is light, medium, and severe scarring of the liver, and occurs when the liver becomes irritated and swollen. The liver cells are produced and replicated and eventually release the infected cells back into the bloodstream. During this process, the Hep C virus kills liver cells, and the liver cells are destroyed by the body's immune system because they're trying to attack the Hep C virus. This leads to the area around the liver becoming inflamed, and eventually the area around the cell starts to form scarring. After many years, fibrosis can become so severe that it leads to extensive scarring, which is the cirrhosis aspect. There's two different kinds of cirrhosis: compensated versus decompensated. Compensated means that your liver is scarred to a very significant degree, but still is able to keep your liver functioning to a somewhat normal rate. Decompensated cirrhosis is basically when your liver is so scarred that blood can't filter through it properly. Your liver essentially begins to shut down, and at that point, the only way to come back from decompensated cirrhosis typically is a liver transplant. So the long-term effects of Hep C, taking 100 people into effect, for every 100 people affected, 75 to 85 of those people will develop chronic Hep C infection. And then of those 75 to 85, 60 to 70 of them will go on to develop chronic liver disease. 5 to 20 people go on to develop cirrhosis over a period of 20 to 30 years. And then 1 to 5 of every 100 people will die from cirrhosis or liver cancer. There is treatment for Hep C that has progressed very rapidly over the course of the last 3 to 4 years. So in 2011 and previously, the only two medications used to treat Hep C were pegylated interferon and ribavirin. Pegylated interferon is an injection that is similar to a protein that your body naturally makes to fight infection, and then the ribavirin essentially works as a steroid to help the the pegylated interferon combat the disease. Fast forward to 2011, there were two protease inhibitors released called Insevic and Victrellis. The Insevic and Victrellis attack the virus directly and stop it from growing, but they can only be used in combination with the pegylated interferon and the ribavirin. The bad part of that is that the disease itself already comes with a plethora of side effects. Usually people relate it to feeling like much more involved in the flu, similar flu-like symptoms, but to like the nth degree. The Insevic and Victrellis combination, along with the ribavirin and pegylated interferon, only exacerbate those conditions, along with the adverse effects that the Insevic and Victrellis bring on themselves. In 2014, the drug manufacturers introduced Sovaldi and Olesio. Olesio is similar to the Insevic and Victrellis. It's a protease inhibitor. Sovaldi is a polymerase inhibitor, where it works by blocking the protein in the body that the hepatitis C virus needs to replicate itself. Sovaldi and Olesio are the two most sought upon drugs right now just because of the cure rates that they provide. There is an off-label indication that has not been yet approved by the FDA to use those two drugs in combination together. It offers the first all-oral therapy for hepatitis C patients, and it doesn't have to be used with the ribavirin to be effective. The Sovaldi and Olesio usually presents anywhere from a 95 to a 96% cure rate for patients. And then the future, just because of the way that the disease and the medications are rapidly progressing, the future can only bring a cure for patients with Hep C and the pegylated interferon-free regimens. Which brings us to Harvoni. Harvoni was literally just approved by the FDA on October the 10th. It's the first once-a-day fixed-dose oral treatment for Hep C. So the once-a-day fixed dose. The pegylated interferon is a once-weekly injection. The ribavirin is up to 6 pills a day every day. The Insevic, I want to say, was 1 pill once or twice a day, and the Victrellis was 1 pill once or twice a day. Since the Sovaldi and Olesio have been released, they're kind of obsolete. The Sovaldi and the Olesio are both 1 pill once a day. So the reason that the Harvoni is exciting is because it's 1 pill, 1 time a day, no injections. The adverse reactions to the drug are supposed to be far better than any treatments of the past. It's 400 milligrams of the sofosbuvir, which is the Sovaldi, combined with 90 milligrams of ledipasvir, all in one pill. It's available only for genotype 1 patients, which makes up 70% of the hepatitis C population. And the treatment length is 12 to 24 weeks of therapy, depending on disease severity. The price tag for the Harvoni is $94,000 for a 12-week therapy, which equates to $1,125 per pill. So it's very expensive. With the Sovaldi and the Olysio, we've already run into problems with most state Medicaids declining the approval of the extremely necessary medications just because the states are running dry of their funds. The Sovaldi Olysio combination are about $160,000 for a 12-week therapy. With that, though, the Harvoni offers a 94 to 99% chance of a cure, so it's apparently supposed to be pretty spectacular. This is Alan. He is the founder of HCV Advocate. He didn't know anything about his disease when he was diagnosed in '96 until he started researching it himself. And then with that, he developed HCV Advocate. It's a website, it's a blog, it's a book, and he is in consultation with a lot of the drug manufacturers regarding hepatitis C and how far he's come just from, not even 10 years ago from being diagnosed. So it's a serious disease that can have deadly consequences, but as we've learned, treatment's rapidly progressing and a cure is within our grasp. It's important to remember that many people are symptom-free for decades before they're even diagnosed. So that's why it's important to make sure you get tested, because even though you don't show symptoms doesn't mean that the disease isn't still progressing inside of you. And it's the long-term disease, or the long-term Hep C virus without being treated, that's going to cause the most damage to your liver. So lifestyle changes, if you've been diagnosed, lifestyle changes such as good nutrition, exercise, stress management, can all help alleviate the side effects and may slow disease progression. There are 3.2 million other people out there who know what you're going through if you've ever been diagnosed. So it's just important to live by Alan's motto: get tested, get treated, get cured. Questions?
No questions. The only comment I gotta make is that if I gotta spend $94,000 on a pill to get cured, put me in a casket. I ain't spending that kind of money.
Well, the good thing about it is that with the cost, that's a lot of people's concern, because it's not expensive, or it is expensive. It's not something that everybody can afford. So the state Medicaid programs are the ones that are having the most problems right now, because when Sovaldi and Olysio were first released, I don't think that they were quite prepared for the market that was going to be impacted by Hep C. It's low income, socioeconomical people that are most affected by Hep C, because it's your drug users, it's people that have unsafe sex, it's people of that lower class that are typically affected by Hep C, and that's the people that are typically affected by the need for Medicaid. So when Sovaldi and Olysio were first released, they were basically giving it out like candy because these people need cures. Well, that ended up running the state funds dry. So there's no money left for these new people that need treated with the Harvoni, something that's supposed to be even better than the Sovaldi and Olysio. On the flip side of that, though, the drug manufacturers offer free drug programs for people that qualify financially. They will give you medication for free if you qualify for their program. So those people that do qualify for state Medicaid, if they find that they can't get it approved through their Medicaid program, then they're referred to the drug manufacturer, who 9 times out of 10 can qualify them financially for their free drug program, so they still end up getting treated. There's grants out there, one through the Patient Access Network, that offers $20,000 to people that qualify financially. So, I mean, there's options for people that don't think that they can afford it. It's better to get treated.
Did you say how they test you for it?
It's tested through liver biopsies, blood, most likely. Our blood usually is what kind of gives it away, because your liver enzymes are elevated. So if you have a complete blood count and a liver, like a liver screening done, which is typically, certainly people of your age, where they test you for those things as you continue to get older, it would definitely show up in your blood. Your liver enzymes would be all out of whack. They would send you for more screenings. They can test specifically for virus, hepatitis C virus in your blood by a viral load count, which basically shows the number of viruses that are within your blood. Like I said, the liver biopsy, there's a more non-invasive fibrosure that's out there now, and it kind of works similar to a liver biopsy without having the invasive liver biopsy procedure done, but usually it's something it's most detected in the blood work.
So if your blood work comes back that your liver functions are normal, then you don't have to worry.
Usually, I mean, it's still good to be tested for it, and usually the test is done specifically by blood work. So if your liver enzymes and your liver functions come back normal, then chances are you're scot-free, because, and especially if people your age, the longer you've had it, the more disease it's doing to your, or the more damage it's doing to your liver. So by your point, unless you just contracted Hep C yesterday, your liver enzymes would be enough out of whack that they would show up on your blood work.
Yeah, well, ours will come back normal, so we're fine.
I was going to say, so otherwise, when I
I'll
went,
get tested.
I'm sure he's tested every 6 months like we are.
Okay.
I am.
So yeah,
We do a blood test every
I haven't had a doctor test me for anything except for my heart
That you
attacks.
know.
I bet you that
You've
you
been
have
tested.
and you don't know.
having heart attacks and things like that, you've been tested.
Okay, Hep C that's one that'll kill you.
Hep C, there is currently no cure for. All of them, I would assume to some degree, are deadly, but yes, if left untreated, the virus is going to continue to replicate in your liver. It's going to continue to cause scarring of your existing liver cells. The scarring will eventually lead to cirrhosis, which eventually
Will kill you.
it cuts off blood supply essentially to your liver. It prevents your liver from doing everything that it's supposed to do, filtering out toxins, metabolizing proteins. I mean, everything that it's meant to do, which is 95% of why you're sitting there alive. It will cut all of that off and can eventually lead to liver cancer.
See, and I'm sure in some of your blood tests that they've done, they've checked your liver.
With your history of issues, your liver enzymes have been checked, and if nothing's been mentioned to you, you're fine.
Okay.
You're
Good
fine.
keeping
We're
it.
fine.
Anything
We're
else?
fine. Well, no, I was just really curious about that. If it just showed up in the normal blood when they draw our blood to see how our liver functions, is what she
It's
says.
your ALT and AST that they usually look at the most.
more than
What are
likely,
those?
we're both okay because we both had major surgery, and if something was to come up, something would have been said before we had surgery.
I mean, I can't imagine with the three of you having the issues that you do kind of across the board that your liver enzymes wouldn't have been tested before now, especially given the age that you are. I know the CDC is making it kind of protocol to automatically order the liver function and liver enzyme test with people of your age, just because it's most prevalent in your age group. 75% of people in your age group have Hep C and they don't know it, because Hep C as an overall disease is asymptomatic. You don't know that you have it because you feel perfectly fine. When I was talking about Pegasus, the pegylated interferon, the ribavirin, and the encephalic pectoralis, most people failed that treatment simply because they were people that didn't know they were sick. They didn't feel sick, and all of a sudden they're diagnosed with Hep C. So they're put on this treatment before this Ulysses and Harvoni came along. They're put on that encephalic pectoralis, and they said that it made them feel worse than knowing that they never even had the disease. They felt worse taking the medication than when they did before they were even diagnosed. So that led to a lot of people discontinuing therapy on their own just because they couldn't stand to take the side effects anymore. Which is why the Sovaldi, the Ulysses, or the Harvoni are so great now, because the side effect profiles are, I mean, very minimal. Occasional diarrhea, headaches, nausea. I mean, stuff that you can live with versus constantly feeling run down like you have the flu 24/7. Just an overall feeling of just awful. So, it's coming a long way in a very short period of time.